From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky. Those of you as far west as Jackson. Those of you as far east as Murfreesboro and McMinnville. Welcome to Pharmacist on Call with your host, Dr. Sean Pruitt, and if you're watching this show, I am your community pharmacist. So everyone, welcome to our September edition. That's right, we're about to hit the fall here in a little bit. So this is your 1 hour forum where you get to call in with those burning questions and those comments that you have regarding anything healthcare related. Well, actually regarding anything, as history has bared out. So this is where you get to ask questions because your doctors and your pharmacists are busy. They don't have time, especially during COVID-19 season. So that's why I'm here for this 1 hour to provide this community service to you. A chance for you to ask questions that you've had about your medications, about your health conditions, or just about anything dealing with health in general that you can't ask your doctor or your pharmacist. So that's why we're here. All right, we're going to start out with our birthdays and our shout outs like we traditionally do. So I wanted to send a happy birthday out to my late brother, Jeremy Hardy, to my cousins, Pharmacist and Cedric, who are actually brothers, Pharmacist and Cedric Daly. Their brothers, good friend Gene Jones, who stopped in the other day and popped in to see me. So happy birthday, Gene's. Gene Pharmacy School classmate, Rolanda Davis. Happy birthday, Rolanda. Good friend, dear friend, Lanika Sean Adams down there in Memphis, Tennessee, also known as Whitney Houston. So I want to send her a happy 50th birthday during this month. Frat brother Dale Strickland, Musada, wanted to send him a shout out. And lastly, my employee, Tremisha, one of my technicians, Tremisha Roberts, I want to say happy birthday to her as well. Oh, you all mean Virgos out there. All right, I did want to announce just briefly, we're going to do a health screening at the pharmacy. We are going to do this Sunday, September the 27th, and that will be from 12 p.m. to 4 p.m., which are our normal pharmacy hours. So we're going to have some students from the University of Tennessee College of Pharmacy, which is my alma mater. We're going to have them do blood pressure and diabetes screenings, and this is going to be of no charge. So we'll have a few students there, so don't worry about it being too busy. You guys come on in and we'll check your blood pressure for you for free, your diabetes for you for free, and certainly answer any questions. They'll also be doing a brown bag, so if you have questions about your medications, bring those with you, and the students will be able to answer questions regarding side effects or drug interactions. They're there to provide a community service, so let's put them to work. It looks like, well, before the calls kick in, for those of you who happen to be new and have never seen the show, this is season number 7, but the show basically started as an Ask the Pharmacist question and answer, where I started with Kristen Priesall and Rory and Chuck Long for some time, where you all would call in and ask questions. That has since morphed into just me. So now you get a chance to call in and ask me anything. And trust me, over the 7 seasons, people have called and asked some of everything. So don't feel shy. Rule number 1, there are no silly questions. So call in and answer. Before the phone calls kick in, I guess we can talk about, COVID-19 and its effects. Of course, we're up to, I think like 6 million cases now. So this thing is rapidly spreading, but it does appear that Nashville is, the numbers are kind of trending down, even though we've had phased reopening, so to speak. So we'll see how it goes with that. For those of you who are still kind of unsure what COVID-19 is and what it does and how it affects you, some of you probably don't even believe it's a real virus, but I promise you it is. So it's in the coronavirus family. So these are viruses, if you can think of a virus as being circular, and it has the little spikes. Those are the corona, so it kind of looks like a little sun, actually. Those spikes are the little proteins by which it infects your cells. They're called little serine proteins, S-E-R-I-N-E. And these are able to infect your cells and your ACE2 receptors, ACE2 receptors. So that's the doorway for it to get into your cell. If there are no ACE2 receptors there, or if this spike happens to be deactivated, then you don't get the infection. So, well, Dr. Pruitt, where are these ACE2 receptors in the body? they're pretty much everywhere in your organs, so in your lungs, in your kidneys, pancreas, heart, and even your brain. Gentlemen, it's even in your testicles. So this thing can penetrate and cause problems everywhere. There are two main ways that we found out that it's killing people is that it causes an inflammation cascade called cytokine storm, and it also causes blood clots. So if you think about the people who were suffering in China in the beginning before we really understood it, these people were developing pneumonia, and on top of the pneumonia, so their lungs were highly inflamed, so those bronchioles were really tense, so they couldn't get air through. But the lungs also develop blood clots. And you think about, them pushing through with air, through ventilators, with all that. No amount of air that you push into the lungs is going to be able to deal with a blood clot. And so that's why we had so many people perishing. But it looks like we've got our first call here. So you guys, we're going to take a call from Lisa here. Welcome to Pharmacist on Call. Let me help you.
Yes, I'm taking tramadol 50 milligrams. I take one tablet 3 times a day.
Yes, ma'am.
And I'm trying to find out if there are any interactions or if it's okay to take fluoxetine with that medication.
Fluoxetine, I think that there may be an issue with that, and I think with tramadol you may be at risk of, it may lower your seizure threshold, and that's the issue with it. But call me at the store. I think that's the issue with tramadol, and it's generally with.
Okay.
Go ahead.
What about with terbinafine or griseofulvin that they use for toenail fungus?
Maybe grifulvin. Terbinafine, I wouldn't think there'd be an interaction, but maybe with grifulvin.
So that one's okay with tramadol.
I think so, but let me double check that during the break. So keep watching.
Thank you.
Yes, ma'am. You're welcome.
I'll keep watching.
Okay.
Bye-bye.
All right. Thank you. All right, good question there. Tramadol is Schedule 4 or 5 pain medication, so commonly used as a first-tier pain medication for patients. Getting back into COVID-19, we know that it now kills us by blood clots and by inflammation. So the way it manifested in the patients in China, like I said, it started out as pneumonia, and then it in the United States, it started manifesting as strokes, as heart attacks, and even in the South here, deaths through diabetes or uncontrolled diabetes. So what happens is, just like the lungs, when it gets into the heart, it causes blood clots and it causes inflammation. So if you think about that, you're trying to get your blood to push through your heart. Looks like we got another call here. We're going to get to that. All righty. Jeff, welcome to Pharmacist on Call. May I help you? Hello, Jeff.
Hello?
Hey, Jeff, welcome to Pharmacist on Call. May I help you?
I'm a 64-year-old male, and I've had a few problems with legs and back. But my biggest trouble is try to keep it clean for the show. The lead in my pencil just don't, it gets up to salute the flag. And
Okay.
if it does, and I'm able to use it, in about 2 minutes in, it just seems like it loses interest.
Okay.
Anything I can take for that, or?
Yeah, a couple of things. And so to get your lead back in your pencil, we got to think about it in 2 ways, Jeff. So we've got to think about the will, which is the desire to use your pencil, and then the ability for the pencil to maintain its stiffness, if you will. So you may want to do it, but the pencil's not cooperating with you. So to help with the will to give you the desire, I recommend something called indole 3-carbinol. It comes from broccoli, and what it does, it increases your testosterone, increases your male drive, and so it gives you the will to want to do it. Now, the way to do it, to keep it erect, is you'll probably need something like L-arginine, which is an amino acid, and what it does is, because what you got going on now, either because you have something like hypertension or your own medication for that or diabetes, your vessels are really small, so we need to open them up and get that blood flow going so we can maintain a sustained erection. So if you follow me, it's all about blood flow. Are you on any medications for diabetes or hypertension?
No.
Okay, so then, yeah, that's what I would do. Oh, the other thing that where we make a mistake too is you can't do things like high fatty foods because that blocks the amount of blood that can get through.
I do eat a lot of fatty foods.
Yeah, so if you got a day that you know you want to do it on Friday, that day you're going to have to eat clean so your blood can flow through smoothly. The other thing is no caffeine products, so no coffee, no Monster energy drinks, no 5-hour energies, because those are also going to shrink the vessels. Yeah, so L-arginine.
First name that stuff you said?
Indole 3-carbinol, I-N-D-O-L-E.
D-O-L-E.
The number 3. Carbinol, C-A-R-B-I-N-O-L, and it comes from broccoli. Or you can just give me a call at the pharmacy, or if you can go to your health food store, just write I3C, and if you're far away, anybody should know what you're talking about in a health food store. The second thing is L-arginine.
Okay.
And
is something else, or just that?
L-arginine.
L-arginine. Can you spell that?
The letter L, A-R-G-I-N-I-N-E.
Okay.
And that will get the pencil to writing.
All right.
Yes, sir.
Appreciate it.
Yes, sir. All right. Thank you.
Thank you.
All righty. Okay, I'll tell you what, we're up on a break. We'll be right back. You guys hang in there. We'll be right back.